Well, this week I'm focusing my efforts on 3 bills that originated, I would say, from people in our district, and that will really help people in our community. They're related to small business development, health insurance reform, and streamlining some environmental regulations. In Kitsap County, we've been really fortunate to have a very successful private-public partnership around our unemployment system. So when people lose their jobs in this state, there's a program that they can qualify for if they have the right skills and enough professional background. They can continue to collect unemployment while going through entrepreneurial or small business training. And in Kitsap, we've had this great program going where dozens of people are getting trained in how to start their own consulting firms, their own architecture firms, their own food processing companies, security, just the gamut of small businesses in our community. That program is set to expire in 6 months, and the legislature hasn't been tracking that. We put the program in place in 2007, just prior to the recession. But it's proven to fill a really important gap, a really important need for a lot of people who are finding themselves without work. And so the bill that I've been working on this week would extend that program and also expand it so that there are more communities in our state that have access to those kinds of funds and training options. That bill is also waiting to get to a vote on the floor by the full Senate. That bill is an idea that came from an insurance broker in Kitsap County who had several clients who were covered under KPS, Kitsap Physician Services. And KPS has been in business in Kitsap County for over 60 years. It's now part of group health, but they decided in December to get out of the individual and family market. So in 6 months, we will have about 2,400 people who will no longer have the health insurance that they've been paying for years. So we've come up with an idea that the insurance commissioner approved to allow those people to go and apply for other health care insurance without having to talk about their pre-existing conditions or any of the other health background information that they may normally have to give. That is a critical element of the federal health care reform, but it doesn't go into play until 2014. So we have broad agreement that for this very narrowly defined group of people, they can go forward under those rules that the rest of the state will be under in 2014. Hopefully that will help hundreds of families have better access to more affordable health insurance than they would have had otherwise. The trick, of course, is getting the rest of the Senate to think that that's a priority, and that's what I've been working on this week. As we balance the budget this year and we make pretty significant cuts, there's also been a lot of talk and a lot of activity around reform, streamlining government. And one of the things that I've been working on is not just how to streamline government at the state level, but also how to help at the local level, because these cuts all trickle down and it's all the same tax dollar. So one of the items that we've been working on is the reform of the state's Environmental Policy Act. And we've been able to bring very diverse groups to the table and say, this is a law that's been in place for 40 years. It hasn't undergone significant reform. What changes can we make to streamline it so that it's still protecting the environment, still allows for public comment and public input in development or industrial development projects, but where we're able to get rid of duplicative paperwork. And so if we can streamline the rules a little bit so that multiple agencies aren't filling out the same paperwork and taking up time doing the same things, we can significantly cut costs at the local government level, and we can cut costs for applicants, for developers, for manufacturers, for people trying to do business in the state. So the trick really is bringing everybody together and getting to those reforms that will maintain the quality of life we have here and the expectations that people have for that quality of life, while making the rules work better for everybody. So that, again, is it's a make or break week for that bill as well, and I'm hopeful that the rest of the Senate will think our efforts to date have been successful and that we should continue moving along those lines. All 3 of these ideas that I just explained originated from people in our county contacting me, either in town halls or public meetings or via email. So these are organic ideas that have grown over the last couple of months. I would love to hear comments on them, concerns that people have about them, and if you can help me in the legislature lobbying other legislators, if you feel these any of these bills would be important to your families or to your businesses, please let my office know, and we'll pass the word along or help you pass the word along.